I want to call up here another one of our elected officials who's done wonderful work for us, and it's going to be sad to not have him in there, who's done wonderful work for us in the State House, Brendan Williams. Can I say our next congressman?
Although arguably our next state representative is Stu Henderson, so thank you, Stu. Well, thank you, all of you, for being here today on such a cold day, and really an imperative time for all of us to take action. You know, I was reading some past history of healthcare reform, and I've been very interested in this. I was back at the Senate Finance Committee meeting in D.C. when they'd reported out the Baucus bill. Like all of you, I've been following this. It's been a historic time. You know, we had a president that once said, and I quote, "Millions of our citizens do not now have a full measure of opportunity to achieve and enjoy good health. Millions do not now have protection or security against the economic effects of sickness. The time has arrived for action to help them attain the opportunity and that protection." That president was Harry Truman in the year 1945. Isn't it time we did something? Yeah! It's way past time for this Congress to stop focusing on a tug-of-war over whether health insurers or pharmaceutical companies get the biggest gain under healthcare reform and start focusing on American families. This is a Congress, after all, that recently found the time to give billions in retroactive tax refunds to major home builders that were themselves already sitting on $10 billion in reserves. This is a Congress that's allowed itself to be terrorized by pretend Democrats like Bart Stupak, that's allowed itself to be terrorized by obstructionist Republicans, and that's just about run out the clock on the president's policy window to effectuate positive change. Consider that in 1965, under President Johnson, by April, the 89th Congress had already committed for the first time federal aid to K-12 education. By July, it had enacted Medicaid and Medicare, and it would go on by fall to enact the Voting Rights Act and major pollution laws pertaining to water and motor vehicles. In contrast, yesterday, December 11th, Dick Durbin, the Senate's #2 Democrat, admitted that he was about as much in the dark about a health care deal as John McCain was. What we do know about the health care deal is not too encouraging. It suggests a surrender on health care cost control. We must insist that a deal without a public option is not an option. Congress acted with breakneck speed in helping Wall Street, and in so doing, I believe, did help to shore up our economy. But where is that speed when it comes to helping those on Main Street struggling with healthcare costs? Is the economic collapse of an American family due to medical bankruptcy less tragic than that of a bank? No. Absolutely not. A constituent of mine had written to me in October to report that she and her husband, beginning at 5 a.m. on a Saturday like this one, waited with 150 others outside of a free dental clinic. Her husband, working 2 jobs, pulled his own tooth out with pliers in order to avoid missing work due to the pain. A local doctor reports that schools, using already strapped levy dollars, are effectively providing respite care to kids with developmental disabilities because of state cutbacks. One local pediatrician reports that her practice spends tens of thousands of dollars just subsidizing vaccinations for kids due to $5.96 state reimbursements. Another constituent wrote this Monday to report that with state cuts to in-home care, he's moving to institutionalize his adult daughter. They simply cannot shoulder any more costs of her community placement, and one of the aspects of the federal health care reform effort, a little-known aspect, would greatly help with those costs. We have over 80,000 Washingtonians just waiting to get onto the basic health plan at a time when that already severely cut safety net faces complete and utter elimination in the upcoming session. And meanwhile, my district state employees face the prospect of losing mental care access due to severe reimbursement cuts. Where's the urgency of the congressional response to these outrages? We cannot afford inaction, but we cannot also afford pretend action masquerading as change. In whatever final product there is, we must insist on a public option. We must demand more. We need to approach this issue with the evangelical fervor of the civil rights movements of the past. As the Reverend Dr. Martin Luther King stated in 1966, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. So thank you for being here today, and together we shall overcome.